All right, welcome back at 6:39. Of course, joining us this morning, we have Dr. Rob and
Aurora.
his furry pet.
I'm sorry.
So let's talk a little bit about kind of an interesting thing. Dogs sometimes need blood work done.
Exactly.
We don't think about this.
Exactly.
Do we?
No.
When do they need blood work done?
So a lot of times we talk about blood work before anesthesias. So when they're being spayed, or maybe a dental cleaning or a lump removal or something along those lines. And then if they're ill, a lot of times as practitioners we say, let's run some general bloods. And then maybe just routine things. As we all get older, including our dogs and cats, probably periodically checking those values is a good thing to do.
That's totally true about that. What are the things that you have to watch for when you are a pet owner? Maybe, you go into the vet, you didn't realize that you had to have blood work done. Good tips to know.
Right. So a lot of times if we anticipate having blood work being done, we ask that we have a 24 or a 12-hour fast, depending on what blood tests we're actually running. So fasting is an important part of blood work. Sometimes we don't have the option.
Sometimes that's really hard too. It's hard to get your pet to fast. You're always like, I'm sorry, I'm so sorry about that. Is there anything that would happen with our pets that that we should watch for that would maybe initiate blood work to take them in and get blood work done?
Exactly. So big things that we watch out for are increased thirst. So they're drinking tons and tons of water. Maybe they're just not eating very well, or they've been off for a couple weeks or a couple days even. Some of these symptoms are very severe, and maybe in 12 hours or 24 hours we decide that, boy, we really need to see some blood work. Or maybe it's been a long-term thing and it's been several weeks or maybe months, and we decide, yeah, we should see that.
Are you seeing anything right now that's kind of peaking when pets or dogs and cats come out of blood work? I mean, is there something that's kind of coming across your desk a lot?
No, I wouldn't say that there's anything specifically that's coming out. Just this last week we had a dog in that wasn't eating well for the last couple weeks. We decided to run a urinalysis, picked up that there was some bacteria in there, decided that we should run the rest of the blood work or lab work and see if there's something more going on there. So sometimes you find things and sometimes you don't. Sometimes we need to be proactive or preactive.
And just have it done.
Yep.
Yeah. All right. Dr. Rob, thank you so much for being here.
Thank
Aurora, thank you for being here.
She's not sure with the wind today.
She's hiding a little bit. That's okay. All right. Thanks so much. We'll be right back.